So now let's move on to the chin. How do we want to treat the chin in this case? Well, we know that the width of the chin in a feminine chin would be the same as the intercanthal distance or the interalar distance. And so we have a good idea of how we want this tapered chin to look. And we already have a nice natural feminine chin. If you sit forwards a little, you can already see this lovely definition. But what I want to do is just create a little bit more projection inferiorly, which will really start to create that extra aesthetic impact. So I've got my boundaries here for how I want the chin, where I want the chin to live. The chin should live between these two lines. And we find the bony surface of the mandible, and we're going to be not injecting onto the front of the bone because that will create anterior projection. I don't really want that. But it's not even just on the inferior aspects of the bone, which would be just down. It's somewhere in between, like this. And as we know, the filler will follow the direction of the needle. And so I want to create projection in the same direction that I'm injecting. So in this case, an injection down onto bone, aspirate projection is what I want to achieve. And this is our needle technique down onto bone. We are using a 25 gauge needle. And the reason is we want to improve the sensitivity of our aspiration. We know that aspiration is not the only way in which we can reduce safety, but it's one of our ways, and we shouldn't ever rely upon it. But if we can increase the sensitivity of our aspiration in cases where we feel like there could be heightened vascular risk, then that is a sensible and logical and rational thing to do. And so I'm injecting this down onto bone and aspirating and then creating a bolus. If I needed to, I could do another one either side of the midline, but we're going to start with the midline.
Sorry to interrupt this video. Hi, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I'm the one doing the injection that you're watching right now. I just want to take a moment to talk about our injectables diploma. So Harley Academy is a higher education college for aesthetic medicine based out of the centre of London, UK. And over 3,000 medical professionals have gone through our academic programs to achieve a postgraduate diploma in aesthetics. They will get a title after their name, PG Dip Aesthetics. If you want to learn more about our programs, how you can gain your qualification and learn how to inject in a really structured, systematic and evidence-based way, then click on the details below and our team will be happy to have a conversation with you. Right, that's enough from me. Let's get back to the video. But if you are enjoying this and you want to see more content like this, please subscribe and click like.
So chin up for me. And a little scratch now. Well done. Touching onto bone, nice and firm there. We're going to aspirate. And then with my non-dominant hand, I can create a little bit of shape for where I want the filler to sit. And I'm slowly injecting.
And again, this is a nice, firm, high G' projecting product. So we're using Rev&S shape again.
Yeah. Slow injection, not only for safety, but also because I don't want the filler to start to move around. I want it to stay where I want it to go. And if you inject slowly, it's been shown that that's how you maximize that. All right, and honestly, I don't actually need to do any additional volume. This was 0.3 mils down onto the most inferior peak of the chin, the menton of the chin, to create some inferior projection and a bit of anterior projection. But if we look at this now, you can see how nice that goes with the rest of the nose, the rest of the face, to work with these feminine shapes that we're creating. All right, now we're on the final stretch, okay, which is the lips. Okay, final treatment today. We're going to talk about the lips. So, as I mentioned before, in this scenario, I'm interested in creating some height in the upper lip because I think this will create that feminine ratio that we would like to try and achieve. Like with the chin, we want the volume in the lips to exist within this interalar or intercanthal distance. And so I don't want to create much volume lateral to these landmarks. I really want to keep the volume within these lines. And we also have to appreciate that the lip is made up of compartments. And so we will have 12 anterior and 12 posterior lip compartments that we need to be respecting. And when we're injecting these lip compartments, it's always better to think about how we can fill the compartments to then give rise to these lovely superficial tubercles that are a consequence of volume that exists within those lip compartments. In terms of vascular risk, we know that generally the vessels run deep. That's one of our key concepts for the lips. And so we're mindful that our injections need to be in the subcutaneous depth. With that in mind, I'm going to be demonstrating a anterograde bolus technique to try and initially create some volume in the lip compartments. And then if that isn't enough to create the height that I want to create, I'll also look at doing some tenting techniques to create that vertical height. So let's begin. Okay, I'm going to just enter this medial compartment of the lip within the vermilion, the lip body, and I'm not just I'm deep enough so that I don't fully see the grey of my needle, but I'm still anterior to the orbicularis oris muscle. In this depth, I'm just going to let the filler do the work. So slowly injecting. My tip of my needle is here, but watch where the filler goes. It's actually going beyond the tip of my needle, and it's spreading into this entire lip compartment. Okay, so that's 0.1 mil of filler, and you can see the height that that has created in that upper lip. And when I squeeze here, I can feel that sheet of filler that's spread. That filler has spread all the way to my index finger, okay, from that entry point. And here I can give it a massage, and we can actually, I'm now confident that this technique will be enough to create that vertical height that I'm after. Let's move now to a more lateral lip compartment, and we'll do the same thing. So into the lip body, and then we let the filler flow. We have to inject very slowly.
And the great thing here is we're not disrupting the compartments either.
Correct.
So the chance of spread between them is much lower.
Absolutely. So look, here we are. That is 2 injections, painless injections, which is often one of the concerns our patients have with lip filler injections. Not touching the vermilion border, but you can appreciate what that's done to the top lip.
Yeah, very impressive.
Let's continue on the other side. I use the bevel of the needle facing forwards because it's more comfortable. We're just moving into the lip body here. A little deeper than this, okay? You won't get a good flow if it's this superficial. Just into this. Now, we don't actually have fat in the lips. These cushions are made out of connective tissue. So we don't have fat pads in the same way that we do in other parts of the face. We're adding hyaluronic acid into a connective tissue compartment in the lip. That's another 0.1 mils injected. And I can feel the sheet of filler between my fingers. Giving it a roll gives that some convexity. And we'll move to the lateral injection.
And this is a GEM stage 1 procedure as well. And part of that is because you're only really focusing on one thing at a time. You find your depth. Once you've got that nailed, you stay where you are, and then you can focus on your volume. You're not having to think so much about how much volume you're injecting whilst moving the needle.
Great, so very standardized here. We've got 0.1, 0.1, 0.1, and 0.1. Very happy with the upper lip now. That's starting to come together. Let's do the same in the bottom lip.
Yeah.
Okay, so remember, we're looking for a good ratio of the upper lip to the bottom lip, and if we don't treat the bottom lip, we're not going to keep that ratio. So there we are, just into that compartment. Then I'm going to flatten out and slowly let the filler do the work. Okay, beautiful. And I can feel there's the product between my fingers. That's a good centimetre of flow into that lip. And we'll do the same on this side. Remember, you won't get that flow if you're too close to the surface of the skin, but you must not be too deep behind the muscle, because that's where the blood vessels are usually going to be living. So it's that intermediate depth that we're looking for in the lips.
We find that if you lift your needle up and you're lifting the lip up as a unit rather than just seeing the outline, it's normally a sign you've gone too deep. What can be challenging is that once you've got some product in there, you sometimes can't quite see the outline of your product, your needle as clearly.
Okay. And with that, I might leave it. I might leave it, because what we've done is the most simple possible thing we can do in the lips. You'll notice there's no bleeding, there's no bruising, there's no swelling, but what we have successfully done is revolumized, targeted compartments of the lip in a very natural way. We've used 1/2 ml of filler, and from profile, from the lateral view, I can see the lip height, and from the frontal view, I'm very happy with the symmetry. The final thing we always want to do with lip filler is give it a massage using a piece of gauze, like this, to enhance the convexity and also just to make sure that there is good spread within the lips.
What we learnt in aesthetic medicine even 1 or 2 years ago is now outdated. Why? Because aesthetics is still a relatively new science, and the research underpinning our work, particularly our understanding of anatomy, has advanced significantly. Hello, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I want to introduce you to GEM, the Global Evidence Matrix. GEM is a dynamic, evidence-based framework that gives injectors a clear, consistent guide for safe, effective treatments, all grounded in science, not in corporate sales pitches. GEM combines clinical research, anatomical knowledge, and injector expertise, and it's always updated with the latest evidence. Think of GEM as your interactive map for facial aesthetics, guiding you through every step from technique to product choice. With GEM, you're not just injecting, you're working at the forefront of medical aesthetics. Join us in setting a new standard for safety and results.
One last look into the camera for us. So let's summarize the entire treatment that we've done for Gabriella today. Number 1, we've treated the temples in the interfacial space. That's created some lift to the brows and the midface. Treated the apex of the cheek in the deepest possible depth, and also then created some lateral definition across the zygoma. At the same time, we've treated the tear trough very subtly, and we treated the lateral cheek fat, which has helped to lift along the jawline. We then moved to the nose, where we treated the columella, lifted the septal cartilages, and treated the dorsum of the nose. Then we moved to the chin for a little bit of balancing, a little bit of inferior projection right in the midline. And finally, we used an anterograde technique for the lips. This is demonstrating gem techniques across development stages 1, 2, and 3, consistent with our principles of working from the top down, lateral to medial, and deep to superficial. How do you feel?
I feel good, thank you.
Okay. Should we get you mic'd up so we can see what you think of the photo as well? The before and after? Goes this way. Right, take a look. Turn your head. Just don't touch your face.
Okay.
What do you see?
I can't see anything. There we go. Oh, wow. Oh.
What do you notice?
I noticed my nose first of all, and it looks great. And my lips look very, it looks very natural. And the shape of my face, it seems a bit more, like less pronounced around here, a bit softer.
Natural?
Yes, very much so.
Look like yourself?
Yes. Thank you.
Daughter's not going to notice?
She might not. She might notice my nose. But yeah, I'm very happy. Thank you. Does this look symmetrical? It looks great. Thank you.
No worries. Thank you. All right. Let's have a look at that lip for you. I think with the injections, it's going to be a little swollen. This side is a little higher. It was before.
Yeah. But is there any way you can balance it?
Let me try.
Thank you.
Final additional adjustment that the patient just asked me to do was just to create a little bit of more lip height on this side compared to the other side. And I've done that just by doing some vertical threads up the lip body, being careful not to go inside the vermilion border. And in doing so, you can just create this vertical height, which I think is actually really brought out the lip. I've done this now, and if you sit forwards, you can see that that lip is actually even more defined and raised than the other. So I'm going to go back onto this side and just do a much smaller number of vertical threads, which I think really finishes off the lips nicely. Okay, give that a little massage. Now have a look in there, see if that's better.
Perfect. That's spot on. Lovely. Thank you.
No problem. All right, let's take some photos.
Yes.
And we're done. So we're back in clinic with Gabriella, who was one of our patients from the last session. And if you remember, we did a full face treatment with Gabriella, mostly focusing in the midface, treating the under eyes. We also treated the nose. I've asked Gabriella to come back. How many weeks has it been now?
About just over 2 weeks.
Over 2 weeks,
yeah.
Great. And we also did some balancing it with the lip at the end, just to get those vertical threads so that we've got equal height. So let's take a look, first of all. Well, why don't you tell us how you're feeling about everything? Obviously, you've seen yourself in the mirror plenty. So
I really
yeah, go for it.
Yeah, I love it. I do. The nose was before was a concern for me because I've had it done before, but it's never been kind of exactly how I want it. So it is perfect, and the lips as well. I really wanted them even, and it's just worked out really well. And it's not too overdone. It's like the perfect amount. And I love the fact that it all looks very natural. I think we got a little bit like in the chin as well. I forgot just the kind of thing. So it all just evens everything out nicely and just softens some of the edges. So yeah, I'm really very happy.
Good to hear it. So tell us about the recovery. How much was there in terms of pain and swelling afterwards?
So the first day or so, I mean, naturally there's a bit of swelling, but it wasn't too painful at all. Like, I didn't really feel anything in my cheeks. I think my nose was a bit sensitive, and I think I bruised like a peach anyway, but there wasn't any bruising. It was just a bit sensitive for like about a week afterwards, and that's only to touch. But yeah, the first few days just a little bit tender.
Yeah.
But other than that, it was perfect. It was fine.
Amazing. So if I take a look now, if I can just turn you this way. So first of all, I really love this definition along the cheekbone. That's settled, very natural. You can't see any of the lines or the threads of filler under the skin. If you turn even more, let's have a look at that nose. So chin up a little bit. So yeah, we've still got the natural curvature to your nose, but it's so much softer. A nice projected tip as well. And we've got this chin projection that's coming all the way from the jawline, and creating a very balanced profile. So now back to the midline. Let's take a look at the lips in a bit more focus, and just smile for us. Really big smile, beautiful smile, and relax. So I'm really happy with the balance of the upper lip. That was something that you mentioned, the asymmetry. So we've created that with the technique, the vertical threads in the lips. And then we did some treatment in this area to try and just create some structure, really important for treating and lifting along the jawline. And you can see just how natural and beautiful that looks. So now, final test is, treatments can look good at rest, but do they look good on expression? So I'm gonna make you do some funny faces now, okay? Do that one again. We like that one, okay? Really big, the biggest smile you can, okay? And now look angry. Yeah, and now blow a kiss. Beautiful. All right, Gabriella, thank you so much.
Thank you.